Hi, I'm Sally Lovett. I am founder and co-director of Stretch and City, and I'm here today with Andy Hicks, our men's mental health campaigner and speaker. So, with Men's Health Awareness Month coming up in November, we wanted to use the opportunity to shine a light on this area, an area that often gets overlooked, and that is men's mental health in the workplace. So, today I'm going to be asking Andy a few questions that we have about men's mental health, just thinking about how we can be exploring this more in the workplace, and this will hopefully give you a little bit of an insight and taster into some of the brilliant workshops that Andy delivers for us for men's mental health, of which I will share a link to so that you can find out more. So, first of all, Andy, welcome along. I'd love to know what first drew you to the topic of men's mental health.
Thanks, Sally. Yeah, well, it was actually a session I was in with a therapist where he said to me, I don't think you've developed your own sense of masculinity. It was quite a challenging thing for him to say, but when I reflected on it afterwards, I thought he was right. And I thought back to when I was at secondary school and it was all boys. And I think I basically decided that male behavior was not very nice, that there was a lot of homophobia, bullying, ruthlessly taking the piss out of each other, glorifying getting disgustingly drunk. And I was just like, this is just no, it's just a bit nasty. And I don't know if I consciously did it, but I think it just stayed with me. And he challenged me therefore, to look at my own sense of masculinity and think what is a positive way of relating to it. And I decided I was going to set up my own men's group. So we've been meeting every month for the last 5 years and exploring what masculinity is and also practicing opening up to each other and talking about how we really are in a way that men often don't.
And why do you think men do find it so hard to open up about their mental health?
Well, I think it is to avoid humiliation and to be a hero. So basically, that there are some studies that show that young babies, male babies, are actually more emotionally open and expressive than female babies. But something changes around the ages of 4 to 6. So basically, when young boys get to school. And the example is of like if you imagine a young boy being pushed over in the playground and they cry, likelihood is they're going to be called a girl, a sissy, a crybaby, and it's kind of a humiliation, public humiliation. So they very quickly learn, don't show emotion, don't get upset, don't be sad, don't show that you're scared or vulnerable, be tough, fight back. So it's kind of drilled in from a very young age at school. And then that is reinforced by the media, by all our cartoons, all our films. The male hero will basically only show the emotion of aggression or anger, maybe lust, and that's about it. You don't see James Bond getting nervous or crying. That's just not in his wheelhouse. And so you think if I want to be like him, if I want to be Superman, a hero, don't show emotion. And if I do, I'll be humiliated. And so it's partly a societal thing in terms of the culture and the media, but it's also kind of policed by us, by men, by boys, doing it to each other and taking the piss out of each other if we cross the line into something that's gay or feminine or immature. So it's sort of we're collectively holding ourselves in certain behaviors. So we just learn to expect if I open up, it's going to be a painful experience rather than something that makes me feel better.
Mm. It's so interesting how you talk about school and how it's almost sort of starts there and then it obviously perpetuates, in the media and elsewhere. I know in your men's mental health session, there's a section talking about school, and it's really insightful what people say about kind of the stereotypes that started in the school place and what they remember from school as well, and how it is such a pivotal time. So actually, with that in mind, talking about stereotypes. In your men's mental health and your masculinity workshop, we talk about challenging stereotypes, and we ask people to share kind of stereotypes that they grew up with. But then, we then go on to try and talk about more positive role models and stereotypes and how we can kind of flip the script, as it were. So, for you, kind of, can you share what sort of a healthy masculinity stereotype, I guess, or just healthy masculinity? What would that look like in today's workplace?
Mhm. I think when we started discussing this with my men's group, we found it quite challenging because as soon as you say, well, masculinity is like being courageous, it's being brave, and it's like, well, hang on, aren't women courageous and brave? Are we saying men are more courageous than women? Okay, we can't say courageous. Okay, what about tough. Well, can't women be tough? So when whatever quality you come up with, it's like, well, does that mean that women aren't that? And where I've got to, what I found helpful is to look at what is negative masculinity. And for me, that is a kind of masculinity or an idea about how to be a man that's limiting, that puts constraints and rules about how we should and shouldn't behave. And it's things like the classics, don't cry, don't show emotion, vulnerability, don't ask for help, don't show weakness, be dominant, be high status, be the funny one, have muscles, have money, have a fast car, be willing to be aggressive and violent if necessary, be okay on your own. There's the quote, "No man is an island." Well, we're meant to be an island. We're meant to be a lone wolf or a lone ranger. So it's basically healthy masculinity is breaking out of those stereotypes and being like, well, I don't have to behave like that. Actually, if I'm overwhelmed, I am going to ask for help. If I'm sad, it is okay to be upset or cry. I don't have to focus on me being the alpha male. I can actually focus on teamwork and helping other people and cooperation. But it's also not about creating a whole new set of rules. Like you have to be vulnerable. You have to be like this. You have to be like that. So I think the most healthy masculinity is actually authenticity. It's actually being willing to be yourself and not be constrained by how you think you should or shouldn't behave because of what society says, or you're worried that people will take the piss or humiliate you or judge you for being a certain way. So I think in the workplace, it's about as an individual, can you bring your full self to work? Can you be honest if you're struggling, if you're sad? Can you admit mistakes and not pretend that you're perfect? Um, and also, can you create an environment for everyone? If you're a leader, where it's safe to be yourself, it's safe to show your emotions, to ask for help, to be honest, to be authentic. There's lots of work environments where honesty doesn't feel safe. You have to kind of go along with the consensus. What the boss says goes. Can you create an environment where it's okay to criticize or to challenge what is happening in the workplace? So I think that's what I firmly believe in for my own life, for my clients, and generally in the workplace is positive masculinity is can you be your authentic, it sounds like a cliche, your authentic self, but be yourself, be honest. Say how you really feel, say what you really want and don't want, what you believe in, what you care about, what pains you, what excites you. That's what I think positive masculinity is.
I love that. And Andy, I'm sure you don't need me to sort of tell you about the men's mental health statistics or high rates of suicide amongst men. Um, in your kind of, from your sort of expertise, if someone's got a male colleague at work or maybe a friend who they're worried about and think that maybe struggling and suffering, is there a practical step that you can share that they could take today to sort of make towards trying to help that friend or that colleague?
Do you mean in terms of like helping them to open up?
Yeah, to open up, or if you feel like they are kind of obviously struggling with their mental health, what specifically for a male, what advice could you give?
I think yeah, it's a big question about how if you have a colleague or a friend who is in this state of like being very closed off, how do you get them to talk? And maybe you can tell that they're struggling in some way. I think that time and place are really important, that most people in the right conditions, if they feel safe, if they feel comfortable, will talk. But if they're in the middle of a work environment or if they're busy or they're thinking about something else, it might not be the right time. So if there is someone you're concerned about, I would suggest invite them for a coffee or a walk or create some time and space where they're more likely to feel comfortable and in the right state of mind to talk about what's really going on. Um, and then just say that you're concerned. Say maybe you've noticed certain things. I've noticed you've looked tired recently. I've noticed you've missed a few things, and that's not like you. Are you okay? And I think if you create the right conditions, and, even people who most of their lives they don't show a lot of emotion and open up, they will because most people do want to share and be honest, but they just don't necessarily do it in any moment. It has to be the right done in the right way.
Yeah, there's quite some great campaigns out at the moment, aren't there, about asking twice as well, kind of making that
Yeah.
right.
Yeah. Are you okay? No, are you really okay? Like actually, because a lot of the time we're only asking it to be polite. We don't really want to know. So you kind of have to show someone, I actually do want to know how you are.
So we so obviously November is Men's Mental Health Month, and it's a great opportunity to sort of raise awareness and shine a light. But we want this to be a conversation that goes on throughout the whole year. So what can organisations do to support men's mental health, to keep the conversation going in November, but also kind of well beyond throughout the rest of the year as well?
Mm. Yeah, I think it's so important that it's not something that people just do once a year. I think that doing a staff survey, collecting some data and doing an audit of how much do the people in your organization think that masculine stereotypes are affecting your culture? Are people able to be their authentic selves? Can they show emotion? Is there an obsession with being competitive and overworking? Is there a lot of burnout? Is there a good teamwork and cooperation? Because these are things don't just affect men and masculinity. This is going to affect how your whole organization is performing. So getting an understanding of what is going on in your organization as a kind of baseline, how people feel about that, and then doing training on things like emotional intelligence. So helping people to understand what emotions are and how to deal with them in a healthy way. Listening, which could be like coaching skills training or active listening skills, because it's all very well saying to men or to anyone, open up, talk about your mental health. But if you open up to someone who's not a good listener, you can end up feeling worse because they didn't really take in what I had to say. So we also need people to develop better listening skills to create the safety for people to open up. And then lastly, I would say role modeling. So encouraging and rewarding leaders who show the kind of traits that are positive masculine traits, showing vulnerability, admitting mistakes, being open about their mental health, things that show people further down in the organization that it's safe for them to do it. Because it's all very well if you go around telling everyone, open up about your mental health, but if you never do it, they won't trust that it's really safe to do it. But if you just do it once, that sends such a powerful signal that in this organization, that is allowed.
Mm. That's in your sessions, we use Slido to invite anonymous responses, and I'm always really fascinated to see what people say when you ask them who their positive role models are. And I love seeing it. It's often dads or people in the workplace, or just it's so inspiring to sort of see, and it just goes to show like the huge effect you can have on someone by kind of having them being such a positive role model for them. Um, so, obviously this has really kind of got us thinking about certain things we can do in the workplace. I know we've also, Andy, as well as the workshops, we've also done things like panel discussions with some clients, haven't we? And I know you also encourage, one of the things is having a men's group as well. So a lot of clients we work with, they might have a women's network or a parents and caregivers network, or, all these different kind of groups and networks. And actually, we really hope this session might also inspire people to set up some men's groups as well, to keep the conversation going. So obviously in November and beyond, we have Andy's men's mental health workshop. We also have a new workshop which is putting masculinity in the spotlight. So there's two that we can offer. So they're both really powerful sessions. They're ones that I particularly love sitting in on, not just because I'm a mother of sons, but just because I love seeing the openness and the vulnerability. It's so wonderful to see, and they really do kind of challenge stigma and spark conversations. So I will share more details of them at link below. But otherwise, thank you, Andy, for your time, and I look forward to reconnecting again in November and beyond, and really delving into this topic more.
Thank you, Sally. It's been a pleasure.